just let them know. Folks enjoy and they join. So welcome everybody to the prevention work group. I thought we could just start with some introductions, and then we'll kind of move on to some of our assessment conversation. But I wanted to just remind everybody of our community agreements that we had set aside. So instead of using Robert's Rules of Order, we sort of just decided that we're going to use these community agreements to guide our work. So be curious, open, and respectful, honor complexity and the fact that as individuals we do not know it all, take care of ourselves and each other, listen for our understanding, not disagreement, take space, make space, bring a spirit of creativity and collaboration, take the wisdom, leave the knowledge, and help each other be mindful of jargon. Are there any additions or any comments that you have about those? So I think it'd be great if we just did some introductions. Feel free to we can share our name, if you'd like to share your pronouns, and how you're connected to prevention work. And I can start with Liz Blackwell-Moore, she, her pronouns, and I'm the Director of Public Health for Cumberland County and also a member of the County Council. And yeah.
Hi everyone, my name is Melissa Hackett. I use she, her pronouns, and I'm the coordinator for the Maine Child Welfare Action Network. I'm also a policy associate with the Maine Children's Alliance, and a lot of my work really focuses on that upstream investment in strengthening families to support child well-being.
Haley Tranko with the Attorney General's Office. I know very little about prevention work, but I'm excited to hear from you guys.
I'm Sarah Johnson. I work with Care Educational Institute in New England, PTTC. And my role here is to help with the technical assistance side of things and just support people in pulling together your ideas for funding.
Hi, I'm Leanne Dash, your pronouns, and I'm the program director of Solar Unite, which is one of the free community coalitions out of South Portland. And I just got back from Nova Scotia, so I'm still
Nice.
Not living here. I'm totally present, reacclimating. Here, yes.
Hi, I'm Mateo. I'm from the KCEAB, I'm the HCCA. And basically, most of the work, I was also an intern at Players Like Maine Kids, yeah, we work a lot in close prevention with youth.
And my name is Lindsay Kenny. I work with Public Consulting Group as an evaluation analyst. So I've been around for a while, evaluating lots of different substance use prevention grants and programs. And right now we're currently evaluating prevention work.
Hi everybody, I'm the executive director and founder of Generation Work. We work with the immigrant by substance use disorder and first and foremost to state communication, but also make cultural connections to the community where we're youth-led, but community-centered.
Excellent. And then we have some members. So we have some public, and we'll hear from some folks later. So, is there anyone online that should introduce themselves as Madeline?
Madeline, yes, but we won't be able to see her until she starts her video. Ella's with us.
Great. Do you want to introduce yourself, Ella?
Yeah, hi everyone. My name is Ella Capin. My pronouns are she, her, and I'm a research assistant with the Maine Attorney General's Office.
Hi, Madeline.
Hi, Madeline. I'm South Portland High School junior, or senior now, I guess. And I've worked with Leanne, and I'm part of transportation over there, and other things like halal quality management. And I'm excited to be part of this and hear all these perspectives. Thank you.
Great, thanks. Hi, Mary.
Good morning. I'm Mary Coyne. I use she, her pronouns, and I'm the coordinator for the Recovery Council.
Great. Awesome. So Really today, I think that the purpose of today is sort of for all of us to kind of get a better sense of where do we see some of the gaps, like what's currently being funded, what's happening, if we can get a handle on that. It will be really hard to get our hands around the whole of it, but I think it'll be helpful for us to just at least air out a bunch of the things we think we know now that are getting funded and what are some gaps. So we're excited to have PCG here to share with us some of your findings. Megan Scott is here from Maine CDC's substance use prevention program that can share some of the work they're doing. I have some information that I got from Maine DOE to share with you all, and then we'll all have an opportunity to kind of put in our 2 cents. And when we are going around and doing our work, I think I might start to just kind of jot some stuff down. Because I think during our discussion time, depending kind of on how time goes, I think it could be nice to get to a place where we maybe start looking at some themes and kind of pulling out some of the themes that we see. We won't lose any of the details, we'll keep the details, but I think it'll be nice to start us moving into some themes so that for our next meetings, we're now understanding like where are the key gaps that and so we can start prioritizing them and figuring out what we all then think we could be recommending. So I think we'll start with you and see if you want to start and share.
So I have slides. Would it be easier if I just kind of talk to the group as opposed to?
Yeah, because I don't have them.
Okay.
Yeah.
Okay. Yeah. All right. So yes, as I mentioned, I'm an evaluator with a consulting group. We've been working, especially with Maine CDC, on evaluating lots of different substance use prevention grants. Like I said, are most recently evaluating the Maine Prevention Network. So essentially, we were asked by the PTTC to help draft an assessment or kind of an inventory of recent and ongoing substance use prevention efforts that are occurring kind of across Maine. So what we did is we reviewed a statewide substance use prevention needs assessment, as well as a larger kind of program level substance use prevention evaluation report that we produced from Maine CDC in 2022. And then to kind of fill in the gaps since 2022, we've looked at some of our more recent grant-specific evaluation reports, and we actually had a conversation with Megan as a substance use prevention program director at Maine CDC to kind of fill some of those gaps in as well and inform the assessment. And then I do want to note that this inventory really is focused on Maine CDC prevention work. So like Liz said, she'll get into some of the DOE stuff that's going on. And this doesn't touch on drug-free communities grants or community level partnerships for success grants. So just want to make that clear. Next, I'm just going to kind of briefly go over the history of prevention in Maine. As we know, Maine has a rich history of prevention, even spanning about more than 20 years. We started the Healthy Maine Partnerships, where there were up to 27 organizations across the state that were implementing prevention efforts. And then moving into the Maine Prevention Services Initiative, which is a 5-year initiative with prevention partners, again, located across the state that were funded to do prevention work. And then now we've moved on to the Maine Prevention Network, which started last year. And it is, this work is led by one organization in each public health district. And some of these district leads have contracted with other partners in their district to kind of spread the geographic reach of substance use prevention efforts. But not only is that the Maine Prevention Network focused on substance use prevention, but also obesity prevention for healthy eating and active living, as well as tobacco prevention. And so really looking to better align prevention efforts through this campaign. So the next piece that we'll talk about is related to the funding, and we look specifically at funding from 2023 and 2024. The grants and funding sources are on different years, sometimes the state fiscal year, sometimes the federal fiscal year. So as you all know, it's a little bit messy, and a rated funding model has been and continues to be used to fund substance use prevention efforts. Some of the funding sources are not directly awarded to Maine CDC, but a portion of them might be. So for grants like the block grant or the state immediate response grant, only a small portion is actually being funneled to Maine CDC for prevention efforts. Lots of it is going to treatment and recovery or other kind of programming. So I just want to make that clear. And also, many of the funding sources are competitive for one-time funding, which makes sustainability of substance use prevention efforts really challenging. And then also, many funding sources are focused on specific substances, not necessarily all substances are being used or misused. So that's another challenge for funding. And I think that might really get into explain a little bit more later when she talks. The next piece that I wanted to give an overview of is the ongoing substance use prevention programming. So I mentioned Maine Prevention Network, where there are district partners who are implementing substance use prevention and other prevention programming in their communities, targeting a variety of substances and diverse populations. And the interventions used vary. I think last year there were something like 17 different interventions that were used. Some of the more popular activities are information dissemination, so sharing information at health fairs or having speaking engagement in the community or media campaigns. Also policy development and implementation, safe storage of substances, drug take back, educational programming, and multi-agency collaboration and coordination. So really aligning those substance use prevention efforts between partners. And then beyond the MPN effort, there are a number of Maine CDC funded prevention efforts that are ongoing. For instance, the Maine Youth and Young Adult Screening, Brief Intervention, and Referral to Treatment, or MyExpert, is a public health approach for identifying individuals who engage in high-risk substance use behaviors. And this really aims to intervene to prevent more severe consequences downstream. So trying to stop that problem behavior before it gets too far down the line. There's also the Student Intervention Reintegration Program, or SIRP, which is a substance use prevention program targeting high-risk adolescents that opens the discussion with youth about their substance use choices and the associated risks with those choices in a very non-judgmental way, so really more in a discussion than a lecture. The Sources of Strength program, which is a suicide prevention program that promotes protective factors and connects youth to each other, as well as to community resources, and really aims to improve health-seeking behaviors. The Enforcing Underage Drinking Laws funds partners across the state to conduct compliance checks, ensuring that drinking laws are being upheld. There are a number of statewide media campaigns that are targeting various substances that Maine CDC also funds. There's also the Strategic Prevention Framework for Prescription Drugs, or SNFRX, Community Grants Program, which allows for implementation of prescription drug misuse prevention efforts in diverse and often high-need communities. SNFRX is really intended to reach those populations that most need these prevention efforts. And then finally, the Gateway to Opportunity, or G2O, which is a paid summer workforce program connecting youth and Maine to local organizations and businesses aiming to build effective actors and improve leadership. So I'm sure that I didn't touch on everything. There's a lot going on in the substance use prevention world, just under the Maine CDC umbrella alone. But that kind of just gives an idea of some of the programming that is happening across the state. So I'm not going to go too deep into the outcome data, but just wanted to let you know that we did look at outcomes. And we looked at a number of indicators from a variety of data sources that include the Maine Youth Health Survey, the National Survey on Drug Use and Health, data from the Office of the Chief Medical Examiner, and a couple others, I believe. And these data, we really looked at the last 2 or 3 data collection periods so that we can kind of take a look over time to see how things have changed. And generally, these data collection periods were between 2019 and 2023. So right before COVID and recently as well. And then we looked at specifically risk and protective factors, so things like rates of adverse childhood experiences and monitoring consumption of substances. Generally, we looked mostly at past month use of substances among youth. We looked at middle schoolers, high schoolers, and adults. And then consequences of substance use, so things like overdose rates and fatalities.
Sorry to interrupt, they're having trouble hearing you on Zoom. Do you think the things that are on the table in between her and the owl could just be scooted back a little bit, the water bottles and the laptops?
Oh, yeah, absolutely.
Oh, yeah, that would work better. Sorry, they just said it's really muffled. They're having trouble understanding you.
Oh, yeah. Okay. Well, we're getting into the good part now. So hopefully we can hear a little bit better. So we identified a number of gaps and challenges. I will quickly run through them, but collaborate as needed. So first, visibility and representation of certified substance use prevention specialists in communities as leaders in the substance use prevention field is generally lacking. Turnover among the substance use prevention workforce is frequent. As I mentioned earlier, long-term substance use primary prevention funding sources are lacking as well. Highly prescriptive funding restrictions challenge the workforce's ability to be adaptive and flexible, especially in trying to reach some of those priority populations that have been identified by communities. Emphasis.
Can I just have you just like do a pause between each one, because these are the ones I'm trying to write down.
Oh, absolutely.
And it just is like a little bit easier if you go just slightly slower. Okay.
Okay, do you want me to repeat the last
No,
one?
I think I've got it.
Okay.
Thank you.
All right. Emphasis on initiatives and programs that work towards system change and focus on upstream building of protected factors is necessary. There is a greater focus, or there should be a greater focus on community-specific risk and protected factors. As we know, the needs and changes can vary greatly from community to community, and prevention is not necessarily a one-size-fits-all solution. Increased multiple substance and cross-purpose programming and funding sources are crucial.
Can you say that one again?
Yeah. Increased multiple substance and cross-purpose programming and funding sources are crucial. Community partners need increased support to implement local policy efforts, especially given that there are so many new members to the prevention workforce. The impact of retail cannabis access on cannabis use across the lifespan is still relatively unknown since legalization was so recent and needs to be better understood to determine effective strategies to combat it. Additional investment is needed to support streamlined data collection and reporting associated with substance use prevention implementation. Currently, it's quite inconsistent in how reach is reported and tools that are used to actually collect that data they vary greatly. Improved engagement of diverse groups of stakeholders in substance use prevention efforts is needed to be sure that populations are being engaged and reached appropriately. There tends to be a knowledge gap among partners and the general public regarding what primary prevention really is and who in the community is equipped to support prevention efforts. Knowledge and understanding about how the social determinants of health impact substance use and mental health could be improved among community members and partners. Knowledge and understanding is lacking across new workforce members about impactful environmental strategies and how to engage diverse populations. Prevention efforts for alcohol among youth and the culture surrounding it are not prioritized, especially when other substances are getting more attention. So just a reminder that alcohol use is still prevalent among youth in Maine. And then finally, robust data to effectively understand what is going on with youth at the local and school level are lacking or challenging to access. This is especially true most recently with Maine Integrated Youth Health Survey data. If school districts are electing not to participate in the MIAs, it can really impact the availability at the county and district level. So just kind of wanted to recognize that challenge.
Will you just say the beginning part of that last one? I'm sorry.
Yeah.
I got the gist.
Yeah.
But I just
robust data to effectively understand what's going on with youth at the local and school level are lacking or challenging.
okay, great.
All right, that was a lot. Are there any immediate questions or any clarification?
Is it in the section? Or is
You sent it to me, picture it.
Yeah.
Oh, that would be helpful.
If you send it to me, I can post it with the agenda for this meeting too on the website.
Yeah. It's a lot to take in, and I know it's really hard to condense it all down. So yeah, if there are questions that come up along the way, just.
That was a really helpful synthesis. Also appreciated the comments about data collection and some of the challenges with that. As we look to measure the impact of things, that feels really important. And I had not thought about schools opting in or out of, for instance, the My House data and how that might impact survey. So thank you for raising that.
And the thing, yeah, and I'd add to the MAS data too is the lack of it being in other languages as like an additional sort of issue that makes it less applicable to groups of people that it's only given in English. I think now they're going to do it this year, right? French.
It's already translated to a couple other languages, but just at the high school level, so that's not.
Okay.
I think it's a regional language in French and Spanish.
Yeah. Oh, French and Spanish. Okay.
Yes. Yes.
It's also being in a classroom when taking those tests, like there's no like, at least at my school, there's no like, you know, it's kind of just like take the test and do it. There's no like reason why we do it, reason for like, if we gave them information to know like why they do these tests, like what we can support them with resources when they truthfully answer the test, I feel like we get better results too.
also maybe having like variable focus groups instead of just like having people throw it out? Because sometimes they just like check off. Or like having a meeting
That confidential link
yeah.
for sure is very important.
Nobody's gonna be honest if they do like your answers right now.
And these, yeah, this is such a great list. I'm like reading it. You all can't see it, probably, but I'm sure many of these will be sort of echoed in our future conversations. I did want to say too, as we do this, even of course we can say like, as so and so said, but I think it's important to say the thing when we go and talk about it, like say it again, so that we see how many times it gets said as like a thing that's missing. Yeah. So don't not say it just because you're like, oh, it already got said.
Yeah, because these were compiled, like I said, over a number of years.
Yeah.
And we heard the same beats over and over again. So yes, I think just reiterating it.
Did you have anything to say?
No, I think that really gets at the bulk of it. Obviously, there's more detail in the assessment or inventory reports, but I think those are really the key takeaways that I want to mention.
I can print that too if folks want a copy of the assessment.
That'd be great.
Yeah.
Yeah.
I'm curious if that assessment and the evaluation, is there an assessment of total funding over time?
We just looked at 2023 and 2024, so it looks at all of the funding sources, I think, Megan, that fund substance use prevention right now.
Yeah.
So it doesn't look at anything before 2023.
Okay.
And do you have that number?
I can pull it together.
I think having I'd love the historical context, but I think at least a baseline, if we're gonna say these are priorities, like how are we looking at what investment looks like that aligns with that? And being able to measure that moving forward.
Yeah.
That's important.
I think you did do a 5-year like evaluation for the MPN 5-year kind of evaluation.
Oh, yes, yes. Yes, I can pull that. That would probably be easier for you to pull. So it'll give us an idea probably from 2016 to 2021 what was that 5-year. Yeah.
That would be great. Yeah, to be like, where are we in the ballpark, you know, of funding? Great. Awesome. Will you be here for a little while, or do you have to leave? Okay, great. Because maybe there'll be some other questions that come up, but I'm thinking that Megan, it might be great if you wouldn't mind coming and sharing your thoughts too, because I think they're probably very in line, but we wanted to give you the opportunity to share with us your thoughts. And feel free to share with everyone more about you and your role. Thank you very much.
So I'm Nikki Scott, Chief of Programs, and I am the Substance Use Prevention Program Manager at CDC. I've been at the CDC for just about 5 years now, and in the manager position for a little over 3. So our program is 7, so we've grown over the last couple years, which is great. And variety of different programs, manage a lot of different grants. So that's certainly answer more questions, but that's kind of us in a nutshell. Really great team. And also obviously work with the first network partners a lot. So I guess how I wanted to kind of look at this is what more could be done, I guess, versus what maybe not what we're not doing, but what more could be done. Like I said, you asked for some of the gaps. And so I kind of tried to look at it in the frame of our strategic plan. So we're working with PCG to update our strategic plan for the next few years. And so I think we're gonna kind of stick with the same goals overall, but kind of really update what we've done. So always our biggest priority is primary prevention. I think a lot of you around this table know we kind of do the primary prevention a little bit differently than maybe like DOE would do or Office of Child Services. We kind of look at that more like community-wide. How do we affect every level of the socio-ecological model? So really, how do we make that community level change and environmental impact? That's outside of schools sometimes and outside of just the education or information dissemination. So we look at our data and kind of where our biggest needs are, I guess. In the last integrated health survey, the middle school rates of use were pretty alarming. They're still low, but they're increasing on a trend that's pretty troublesome. So we have been investing some funding into middle school age focused work. And so we're going to be able to do that. Still our youth mattering, connection to community, mental health. Those numbers are still far lower than we'd like them to be. So that's a priority. We need to do more to reach that young adult population, 18 to 25, and consistently have the highest use rates in Maine and some concern mental health issues that we want to address. And then, especially for priority populations like LGBTQ+, we see those numbers on the highest are pretty alarming as well. So that's kind of where we've focused a lot of our efforts over the last few years. And so I've kind of used that as our frame to talk about some gaps around. So again, like the 18 to 25, higher education population, we really do see some opportunities and some need there. Trying to, I think a gap occurred in the state a while ago. Leanne probably knows this better than anybody else with the Higher Education Alcohol Prevention Partnership. I mean, that was a program that really, I think, mobilized the colleges around prevention and, issues around that. So we just don't have that anymore. And so I think we'd really like to do more with higher education. We have some irons in the fire right now where we're trying to rebuild those relationships and then, consider maybe some restorative practices. So maybe, modifying our student intervention reintegration program as a restorative way of violations, substance violations in higher education. We'd like to expand expert, the expert program that we're doing in higher education. So some opportunities there, I think, where we can make some impact. I want to talk a bit more about expert in a few minutes. Again, the middle school age programming, we started this intervention network with a pretty large pool of funding for that, which we're not going to have this one-time funding. We're going to try to continue that work through our Partnership for Success grant, but we're we started some really great programs in schools. We really tried to focus on evidence-based programs. SAM's is really moving towards wanting us to do more of those evidence-based programs. So we provided our brain prevention network with some funding to focus on that. But I do still think there's opportunities to expand that to, out of school-time organizations, so the rec centers, Boys and Girls Club, teen centers, places like that, to really have some opportunity there to expand that in forward. And then continue to support the schools. Sorry, I'm kind of all over the place.
I think we're all going to echo that when it's our turn.
In true, if I can illustrate more like what we do with our federal grants, I was in the middle doing this yesterday and get an urgent, request for additional materials from SAMHSA for one of our grants. So of course I have to drop everything and provide the information so that we can get our continuation, application moving forward. So, so that's the kind of stuff that happens, and I think you all understand that too. We're trying to do a lot more with FASD, alcohol spectrum disorder, and substance use infant prevention. We really don't have a lot of funding to do that. I do have a new person on my team that's going to be focusing on that, but what is the need there really? I mean, I think there's a focus for providers there. So really kind of doing a comprehensive needs assessment to really get that perspective of what screening is done pre-conception. And again, that could give us back to the 18 to 25-year-olds, the higher education. What could we be doing in colleges to kind of get people of childbearing age to think about substance use and how that might impact later on in life if they decide to have children. So I think there's a lot of opportunity there that we'd like to explore. And then also we have quite a few pilots happening right now. So to get us back to that, primary prevention, we're going to be piloting a peer navigator program with the Action Network. And that's going to be a peer and near-peer kind of program where they're going to, connect and then kind of try to help the younger people find resources that they might need, whether it's with adults or organizations, communities. But really that kind of, youth and young adult, that near-peer kind of connection is, been shown to be really impactful. So we're going to try that out. We're working with Maine to pilot a mental health conversation program in elementary schools. We haven't really done a lot with that age group. A lot of our funding is focused on about 12 to 18, so we're trying to go a bit above that and trying to see what we can do before that so that we can, impact that middle school age before they get there. So doing a little bit more at the elementary level would be something new and something that we would like to expand. We're also piloting Strengthening Families program with the Midcoast Youth Center. And that program, if you're not familiar, promotes parenting skills and positive family relationships through trainings and skill building and some family sessions. So I think that will be an exciting pilot. But again, pilot programs only last for, we only have the funding for so long, and then if they choose to be impactful, we'd like to expand that as well. And then we're also piloting Triple P, positive parenting program that's levels 2 and 3, which is more of like the brief kind of one-time assistance with parents who need it, and then kind of be more targeted counseling for parents. So we're really trying to get a lot of our work to align with the child safety and family well-being plan. And so a lot of that is making sure that parents have those skills and that support that they need to connect with their children and such. So that we're piloting with CAP agencies and some of the child child abuse councils. So there's some new partnerships there, and also I think some new opportunities. So those are a few things that we'll be trying to expand our work to. And then the ESPER, which Lindsay mentioned, so that is something we're just piloting right now in 3 school-based health centers. I think there's a lot of desire across state government to increase the number of screenings. ESPER, whether it be through primary care, through other schools, through college health centers. So we started in school-based health centers. We're just wrapping up year 1, so if anyone's interested, we should have some information soon. And then for the next school year, 2 or 3 more school-based health centers, and I'm trying to get to at least 2 college health centers. And so, just really trying to see how, what that process is, how we can expand that, maybe do primary care and such. So, great coordinator who's managing all that, and a lot of good connections in the state. So, so it's been pretty exciting. But, ultimately our goal is universal screening. I really think that, obviously, we know that the evidence shows that the sooner that we can intervene, the less likely we have a problem later on in life. So, so that's been really exciting to see. We would like to expand that. And this kind of aligns with our goal 2, which is more like the secondary prevention strategies. And so we're having to kind of dial back a little bit of our, kind of harm reduction, secondary prevention side of things from my team. Obviously, there's still a lot of that going on across the state. But I do see now that I think the gap is that, our prevention folks on the ground, really serve as advocacy in our communities, and so they really have done a great job of being across the continuum. And so I think, having them there as kind of one to make those connections, I think is really important as we look to work across the continuum. And I think I'll plug Liz's session at the opioid conference, I think, to really, I know we could be doing a better job of working across the continuum, because there are so many strategies that cut across the continuum. So let's see. And so then our third goal of our strategic plan is more about strengthening collaboration among communities, policymakers, etc. And so I think, because pretty much all of our funding comes from the federal government, and as Lindsay said, comes with specific things that they want us to work on. Sometimes we don't have the ability really to have the time. A lot of the grants come with, you must start implementing strategies within 4 months. So, but then also we're supposed to be using the strategic prevention framework, and that takes time. And so I think, one of the biggest gaps that I think for our programming is not having the time to really build a coalition, get that community support, really time to address the systems. We do the interventions to meet the needs of grants that have been established, but what long-term change are we really making when we're not addressing the larger system? So I think, if there's something that this group can work on, it's really, providing that opportunity for our partners to really dig in, build those connections, be responsive to the needs of their communities, having the time to build, maintain the coalition, work through the strategic prevention framework, and just, build that capacity and the community-led processes. I think one of our partners is addressing transportation. They're doing the youth, there's so many youth programs, but if the youth can't get to them, what's the point, right? So making that connections, I think, they're serving as a kind of a convener in the community to make that connection to get transportation more in their district. And I think, that's substance use prevention. And I think we don't always recognize that part, addressing those needs, is substance use prevention. And so I think having funding that would allow us to take that bigger picture approach is what I would love to see. And then also having the time to work on the policy change. I mean, I know, so United or South Portland, it took years to get to where you are, but having that time to be able to do that, to really, and the impact that it's had is just phenomenal. And so I think, making sure that our partners know that they have that time to do that hard work. That's really going to make that impact, which I think, is hard when the grants are only 5 years. So, and then another big thing for getting that community engagement is our funding never allows us to give stipends or incentives. And that's really needed. We found when we were trying to get sources of strength in schools, teachers need a stipend. I mean, this is extra time, and we really give them a stipend so that they can participate, or just to have advisors private groups, or just to get focus groups, people to attend focus groups and be valuing their time by providing a stipend or incentive. I think is something that we are never able to do with our current funding. myself, so really, again, like I was saying before, that is substance use prevention. I believe that SAMHSA is kind of moving in that direction of recognizing that addressing social determinants of health is prevention as well. So I'm hoping that we'll kind of start seeing that as more of that bigger picture is allowable. But I think that's something that's we have to do more of. And workforce, we've talked some about that. I think fellowships, internships, having funding to do those sorts of things really can get people interested in the field of prevention. One of my new staff, she took a class at Farmington that's taught by Rob Rogers, and that really got her excited about substance use prevention, and now she has a job on the team. So I think having those opportunities, exposure to our work, I think would help to capacity. And then also, even on my own team, we're almost entirely federally funded, so we spend a lot of time managing grants, which I think sometimes reduces our capacity to be the subject matter experts in our field because we're managing a lot of contracts and such. And I was able to dig into the work with our partners. So data, that's also in our, I think as far as data, what Lindsay said, certainly is, I would echo that. I'd like to see a little bit more mapping of, our impact, whether it's, things like, showing the connection with outlet density and impaired driving and use rates and other consequences, or, how we're connecting our responsible beverage seller trainings to our compliance checks to, other just mapping to really show that impact. And data reporting, that is an issue. That's something that I would love for us to be able to solve, is how do we better report reach, and then also lessen the burden on our partners for reporting all that. We don't have any sort of reports on return on investment of our work in the state of Maine. So, what's the cost of substance use in the state, and then what's the benefit of prevention? I really think having something like that would be a huge benefit to our work to be able to demonstrate that this saves money to invest in prevention. I think as far as the supporting level of data, we also data literacy is something that we definitely need. I think a lot of our partners want to be presenting the data at the local level, but are we really telling the story that we should be? So that's something that we want to work on a little bit more in our team, but definitely increasing the data literacy at the local level would be, I think, and then goal 5 is identifying and addressing substance use related health disparities in Maine's high priority populations. So SAMHSA is expecting us to use more evidence-based programs, but most evidence-based programs are not culturally relevant to the priority populations that we have in Maine. So I think, a huge gap is not having those programs. And so how do we fix that? So I think, we have some ideas. We're starting to create some really interesting relationships, new relationships, especially for our grant program. And so how do we, increase support there, continue those collaborations, and we help modify those programs in the state. Do we have, the capacity here in the state to start working on that? We're taking what we know is evidence-based, and then how do we modify that so it's made in these different communities, and also, providing more resources for those communities as well. And then continuing to contract with groups like Alfie and those that have that specialized expertise with some of the creative populations. That's I talk very fast, and so that's kind of just the high level of some of the things, but I guess I would say, how we can kind of, maybe just have a little more of that freedom to work at the systems level. I think we're trying to get to that in Maine, but I think it's going to take
Who's got questions? I'm trying to.
I was like, oh, it's deep. I just want to say, Megan, I really appreciate this overview. I want to really underscore that I appreciate the conversation around SDOH as substance use prevention. That feels like something I show up in lots of spaces and say we need to be saying more. So appreciate that, and that there's a potential shift with SAMHSA there. I'm also just love the idea of the return on investment. I think those of us doing prevention work know how challenging it is to sort of make the case for prevention, and I think having that ROI really helps. I would say, at least in my conversation with policymakers, to say like, we invest here, it means we have to spend less here. So I love that idea. And then I'm curious about the pilots. So they may all be different, and maybe it's a follow-up, but I'm just interested if those are also federally funded, or if those are different funding sources, and if there are timelines for those, where there might be opportunities to look at sustainability once you've evaluated, because I think there's a lot of potential there.
So the peer navigator, the elementary program, and the strengthening families is co-funding with our state opioid response grant. So they just increased that to 3 years. So we'll get 3 years to pilot the programs, and then go from there with those. And then the triple P program. I think I'm going to pull a couple different funding sources to fund that one. But it's, so I mean, it's.
Blending and braiding is great.
Yes.
Yeah, please.
So, thank you. So my opinion, because I was into presentations, you guys talked about also like research at the level, like we're like going to meetings next year and there's like not always a lot of work that's like geared towards like those communities. For example, the peer navigator program, are there people of color in that space who are like peers, and like how are you guys educating in like spaces of like that don't like have conversation on substance use disorder, or like they don't even know what it is yet, and then like having that educational factor. So like we're here, like we're kind of like over here, and there's communities that are still like learning substance uses. So how do you guys?
So that's a good question about the peer navigators, and I can ask you actually about that. And so I think, where we've really started to be able to have those conversations is with our strategic prevention for success grant. So we're offering, not prevention for success, I'm sorry, prescription drug prevention. So we offer community money grants. So they're less than $5,000, and so we've this round, and then we just awarded our next round. We've actually started making a lot of relationships with some of the ECEOs, Portland and Lewiston based, and so, but we are hearing so much about the needs for training, and so we're supporting them through the implementation of these small mini grants. But then now that I have my coordinator, I had a gap, and we really do want to try to figure out how we can strengthen the relationships. What is the training? What support is needed to have those conversations? And so, so is it, do we start with focus groups? Do we, pull a group together so we can start working on, what's evidence-based, or what that training programs be? So I think, there's definitely more that we need to be doing, and I think, we're getting started, and so, we'd love any help there, but I think that's where we're getting started.
Also, I did an education
So as being part of the state, we always offer or have that available if it's requested. So so it means something that
is it always something from sorry, because when you notice is like a lot of people don't want translators from their own community, so is there like a way to have institutions where the person is from somewhere else?
I say I'm not looking into it more, but I don't know what it does to the state if we feel like we work to the state. So like services,
Yeah.
and then,
I don't know if there would be that level of detail that would be available to someone if it was outside their community or not, but I appreciate you raising that.
Yeah.
Still, because sometimes some people realize that there's something that they don't.
Yeah.
And they're less likely to talk about it.
Yeah, it's a really important point.
right. So,
I had just like a funding question. So essentially, whenever we get a number of like how many dollars are being spent on substance use prevention through Maine CDC, are you saying that essentially all that money comes from the federal government and there's almost no general funds, like the state has not allocated any funds to substance use prevention?
so my program is not getting a general fund. So we get some funds from Maine, tobacco settlement funding. And then we did get some of the opioid prevention treatment funding, which is, funding that the state gets from, pharmaceutical fees that get paid and distributed to the state. So I guess those would be the only kind of, the closest thing to state funds, but my program at ACC has not received any general fund.
Okay, so get some FHM money and that's the OP&T, is that what you're saying? What's that called again? Opioid
Prevention treatment fund.
And did that happen again this year, or did that go away?
So the money that went out to Maine Prevention Network is not available after 6:30. We do have some that was allocated to the expert pilot, but it was just for that time. So no, we have what we have right now.
Okay.
There hasn't been a commitment for more.
Yeah, I just want to say that again, like there's no money
Yeah.
to the state, from the state general fund, including excise taxes and all of that is going to prevention. It's all federal funding that you have to apply for and write grants for and then manage. Okay, I just want to say it out loud.
And it's very restrictive.
And it's very restrictive because it's one of those things where every room I'm in and talking about the issue of opioid use disorder and substance use disorder, everybody talks a huge game about prevention and how important it is and how much we should be doing it and why are we doing more, and yet it's $0 from the general fund are going into substance use prevention, which is just like it's like a cognitive dissonance that I can't even like sort of understand. So I think it's just on note one more time.
So I would say that there's two funds that aren't competitive. So that would be the substance, well, now they changed the name of it. So it's the Substance Use Prevention, Treatment, and Recovery Services Block Grant. So all states get that. And it's mandated in federal law that at least 20% has to go to primary prevention.
Okay.
And so that comes to the Office of Behavioral Health, and we actually get 22%
Okay.
of that. And then the state opioid response grant is not competitive.
Great.
So the Office of Behavioral Health is giving Maine CDC, so part of it goes to my program, part of it goes to the harm reduction and infectious disease program, 15% of that. So, but then the other grants that my team has, we didn't talk about the PDO grant, which is more of a harm reduction grant that we're funding, amongst other things, 5 coalitions in kind of the highest need areas in the state to maintain, enhance coalitions to kind of look at overdose prevention at a real community level. So we're funding 5 coalitions there. So that one is very competitive. The PFS grant is very competitive. Only 5 states got it. And then the civil rights grant is competitive. So
But the ones that aren't competitive, you still have to do reporting on those, and there's like grant management around it where it's not like they just give it to you and now you get to like go do like use the money for these sort of higher level things. Like I'm just thinking about how much like there's like I know at the local level there's such a need for human infrastructure for doing this work, and that if you don't have your human infrastructure is all tied to grant funds, and there is something about not having that specific outcomes that allows you to be doing bigger thinking and doing that sort of bigger planning and seeing what's happening and being able to do these pilots, you know, and then take the pilots and try to figure out how do we make them sustainable. How do you even, like, that's so hard to even do if you don't have like the human infrastructure for it.
One thing I just want to plus one to is this, we've been having this conversation a lot in the trauma treatment prevention space around evidence-based programs, and I appreciate that you named that. Like a challenge with those is that a lot of them are not informed by certain communities and certain populations. And so I just want that to be something that we talk about in this group as well. Like, how are we improving health disparities? How are we adapting programs to meet the needs of certain populations and communities? Because that is, I think, a challenge.
Other questions? I'm aware that now I'm on Zoom. If there's other folks that have, or anyone else in the room who have questions for Megan.
Thank you for you. It's a lot to manage. I mean, I'm very lucky to be in Cumberland County and get to work with business staff. Even though I work with every one of their staff members all the time, and I could not do what I'm doing now. And that they have all of Cumberland County 37 staff. You know, I don't know how many it is now, but not many to do all of Cumberland County. You're like, I'm really fortunate, but what about Gorham? And you know, like it's a lot, and so it's just there's not enough capacity. So we look at the Smith, which is a strategic prevention framework, so assessment, right, and cultural competencies in the middle and sustainability, which we often forget to even look at that middle part. We're just like, we don't know what these are, and looking at it, and let's work on it. But the sustaining is always trouble. And people come and go all the time, quickly speak, you know, and that's it. Oh my, I'm meeting with fourth principal, 7 years, you know, so you're just like, you know, you know, so then you have to start over again. And so it's just a lot and not enough.
Those just take time. It's like a really important glue, and they take time, and they're usually not incorporated into federal funding as a deliverable. So I think it is something that we want to be thinking about. How did this group make recommendations about supporting and supplementing the work that's happening, right? It's not necessarily programmatic. It's how do we give capacity for folks to be doing that big picture relationship building, community building.
And I just offer this, Colorado, when we were trying to figure out, you know, the system that we wanted in Maine and such, I think Colorado has an interesting model. They kind of have two options for when they're giving out their funding. And so one is just really that, you know, funding a coalition, so really giving time to build the coalitions, you know, have that community engagement. And then the other option is, you know, if you've identified, you know, say you offer sort of practice in your high school, so they give you funding to do that one thing, so that one policy change, that one big picture thing. And so, you know, the funding is about the same, they say for either option, because they know that it's, you know, really what they're funding is, you know, that capacity, that person that's really gonna be that kind of that backbone, I guess, for the community or for the project. And so I thought that was, you know, I guess depending on where a community is in their level of readiness, I guess. So that was interesting. That's what we try to think about is, you know, the granted funding, like we do the best option, or do we, you know, fund for a specific, you know, take this pot of funding and do this one specific policy or whatever, you know, and I don't know. So,
Can I ask and maybe you might not have the answer to this, I know we kind of talked about this a little bit in the past, but are there things you do that you feel like you could use like a boost, like an infusion of funds that then would lead to other things? That because the way the Maine Recovery Council's funding comes in, there's like more money up front, and then the way we kind of determine to spend it is that it'll you know, slowly, the amounts that are given out by the council will dwindle over time. So in this first year, you know, maybe it's 4 million, but then it becomes 3 million, 2 million. Then less and less for that prevention pillar. And so, and you don't have to have the answer to that now, but I guess I'm thinking, I think that would be helpful for us to know, are there spaces that could use a big infusion that then wouldn't create a cliff for the state or whoever you fund, but that like gives a boost that then could be sustained by other funds or in some other way? Is there something offhand you can think of, or is that something you want to like think about?
I mean, I guess, just offhand, I mean, I don't know, I always feel strongly about the coalition model and just building up that capacity. Because we don't have everybody bought into this is an issue, and understanding what their role is in the broader scheme of things. So, is it that fusion to really build up the coalition to get to that state of readiness, and then, then does that lead to find additional funding, or, you hone in on what that issue is, and then you don't need as much of the capacity.
Yeah.
More, but I mean, I don't know. I just, I'm a community organizer, so I always go to, we're not going to see real change unless we get more. So, and determining what it is that the need is. So, so I don't know. That's the main CDC answer, or that's just Scott's answer? I don't know.
I just think I get Scott's answer right now. Yeah. No, that's, I mean, and I do think there is then, once the coalitions are going, there is, 10 years of federal funding that's available if people write those grants. And there's a lot of people who've done them, and then it's $125,000 a year for 10 years, which is a ton of money into a coalition. And how many DFCs are there now? 700?
Across the country, 700 country, we get
13.
Yeah, so.
Yeah.
But I mean, my hope is that, say with the work we're doing with the Midcoast Youth Center, I mean, hopefully, that could, they can then leverage that to maybe get a Partnership for Success grant or DFC, and so hoping, and even with some of the mini grants that we're giving out to communities, I'm hoping that maybe that will leverage then, capacity to be able to apply for maybe a larger state grant or some of the federal grants. So it's just kind of, I guess, getting things started and seeing how to leverage that for.
Great, thank you. Any other thoughts or questions? I'm sure, I mean, if you are able to stay, I may pull you back in.
I mean, and I know this issue's gonna look it up, but I mean, I can easily tell you how much money you have. So, that's all.
Yeah,
There you go.
sure. You can tell us, like, you need to leverage, do you know right
I can.
now? Okay, that's great. I feel like that would just be helpful.
Yes.
I know I've seen, like, the FHM dollars, it's like 770,000, right, that comes from FHM. But yeah, it'd be awesome to have a good sense of the dollar amount.
I'm just gonna put this out into the ether. I would love to think about how we get that data across agencies. Are there other folks in DOE, in DHHS, and other agencies that feel like they're doing prevention work related to alignment with substance use disorder, and how we can think about the collective pool? I'd love to know what CDC is doing, but like, what are the other funding sources so we have as good a number as possible?
Well, that's a good segue. Because I got information from DOE.
see that they have a lot.
Just putting that out there into the ether here.
Yeah. Thank you, Megan.
Yeah, thank you, Megan.
Well, it seems like a good time to share what DOE sent me. So it's not a dollar amount per se, but they did send me, I asked for a kind of, like a week and a half ago. So it's not like I gave them a ton of time. But I asked them for kind of what are their current prevention efforts and what are the gaps they would kind of recommend. So they are building assets and reducing risk is one of the models that they have been pushing the last couple of years. And I know there are some schools that were part of the original some schools in Maine that were part of the original pilot for this, for bar. I know West was one of them, and there were a bunch, maybe somebody else knows where the other ones were. There was one up in, yeah, I know there was one in Midcoast and then maybe one up north. And that, there were a few, I'm not actually sure, but anyway, they put out a call to schools for who wanted to do bar, and they thought they had funding to do 10, and they had like 71 who wanted to do it. And so the model, essentially, the way the model works is it's really helping create a multi-tiered systems of support. So some schools do this without needing the bar model, but the bar model just gets schools there quicker. And so they, as you can see here, they were able to, they're supporting 96 schools. So it's like a 3-year training period where they work, where bar folks work with the schools to build out their multi-tiered systems of support. And, you can find out a lot more information, but you can see here, there's like the primary prevention that they do on the back, or the primary work. So it's like universal things they're doing to create cultures and communities within schools that are most supportive. And then there's secondary, tier 2, where they do, some young people might need more supports and more things to be able to build their skills. And then there's the 3rd tier for students who need highly specialized supports. So the school district, so Maine DOD has, you can see here, they have money for, I think they have money for some of the schools, but in after FY 24-25, there will be no funding to support the bar in the schools. So folks would have to get local funding to support that work. Once the 3 years are up, folks only need to spend, it's like $15,000 or $30,000 to get, it's like just technical assistance over time. So there's like this big upfront cost, and then the schools are in this place where they have a lot of the skills and support they need. And so you can see there's outcomes across the board. So again, this is one of those things where it's like, it's a systemic approach to getting outcomes that are, supportive relationships, better student engagement, less absenteeism, less discipline incidents, less suicide, and less substance use. So anyway, I just wanted to explain it because I think it was one of those projects that is on the surface, people don't totally understand exactly how it's substance use prevention, but it is creating that system that then allows you, if you put more into that system, then the system gets better. If you just put more into schools, sometimes it doesn't necessarily, more isn't, without coordination and connection to a larger thing, isn't always better. But having the system then you can build upon can be really helpful. So anyway, that's one thing they have. They also have their SEL for Me platform, which is really around social emotional learning. They hired a social emotional learning implementation specialist. And then you can see the things they said that were in development that are not currently funded. And those are providing model sample district policies for mental health and mental health screenings and prevention services. They also could use funding. They want to work on enhancing mental health support systems. They have some needs for data collection around that, improved utilization of Maine Care to support school health services, continue to build relationships within schools to identify and increase the capacity for mental health resources. And then they have some things on here around promoting identification strategies and referral processes for at-risk students. But they also have universal screening in here as a need across Chatham. So this is what we have from DOE. It doesn't give us the dollar amount or the number, but I know they see themselves as a part of the prevention efforts and infrastructure. So I don't know that I have anything I can answer in terms of questions that anyone might have, but maybe people have comments on this.
I just am always noting where I think something might, so funding that's like pandemic related funding like
Yeah.
ESSER, I'm curious to CDC if any of the funding sources are tied to that. Like we know they're gonna tail off, and
Right.
so are there general fund needs or other ways to supplement work that has gotten underway and is promising but will want to just go away. So I'm just sort of underlining that. I would just note it as sort of curiosity they didn't mention anything about community schools. I'm interested in that too.
Yeah.
So maybe as a follow-up that that's another model that I would name as an investment in schools as is being focused on prevention and really also then more sort of full family approaches.
Mm-hmm.
I know that there's been some initiative and some fits and starts with funding for that. So that also can come with capacity, additional capacity in the form of a coordinator to do that community services into the school. So I would just name that as a sort of point of information. Liz, I don't know if you can speak to this at all. I think I remember from the community conversations that the Recovery Council had that there were some folks who talked about BAR in year one of the funding. I'm just curious if there was your take on the sort of council's response to that in terms of thinking about that as a promising model for funding.
Yeah, I mean, how I would summarize the conversation is it was brought to the forefront of something to fund in the first year. Because we did that fund, like that sort of not emergency, but our initial funding.
Yeah.
And I think the council, there were some folks on the council who felt like, one, there was a question about how closely tied is that to opioid use disorder prevention.
Mm-hmm.
So there was this question about like, is it substance use prevention to do this?
Yeah.
And then I think the other piece that came up was around DOE's ability to find other funding.
Okay.
And that they may be able to find, that there was ideas on the council that maybe they would be able to find other funding and didn't need this.
So again, thinking about where this doesn't supplant, but could, okay.
Yeah, so I think those were sort of the two things. And they were able to find the funding.
Okay.
So, I mean, they were able to find the funding for that second year. So they had 80 schools. I think when we were originally looking at it, they had 80 schools that had done the first year, but they didn't have money for the second year.
Okay.
And they were able to find the funding for the second year. So it sounds like here they're extended to get to 96 schools to be fully funded. So they did find it. So now it's more that there's no additional monies to support any additional schools. Or perhaps also we could ask the question of what does it mean for schools after they've done the 3 years? Do they have any funding for that, like ongoing TA dollars?
And I see in development but not currently funded. So they also, it seems like they had ideas about additional work they could happen if there was a resource.
Right,
Okay.
exactly.
Okay. That's helpful, thanks.
And then the DOE, yes, the legislative requiring Narcan training for high school students as an extracurricular, so it's not, everyone doesn't have to do it, but in our school, our health teacher has already taught her health class, in June, like one of the last classes. And so, and that's sophomores, and so else the DOE's did a training, it was like 300 people on training on how to do the training for high school students. So, but it's not fun. And it's been interesting to see the reaction from adults, like the school nurses at first, well, we've got there's two of us that, okay, are you around in the summer?
Right.
It's
Everywhere all the time.
And even the police now are required to carry where they work, and our South Florida police didn't carry. So just some, slowly people are more, all right.
Yeah.
And the students were like, yeah, yes, we'd like to learn.
Well, I think that's something about like the young people now. It's like we're willing to like open up our minds and figure stuff out. We're willing to talk through it, work through it, and I feel like that's something that that struggle I run into when doing work like in prevention is like it's not necessarily the youth that I have the problem with. It's some of the older people who just don't understand. You know, they don't. They're like, well, I never like I had a conversation with one lady, and she's like, well, I never had I never had bad mental health. Why did you? And I was like, so you just put a barrier between us and said, oh, this is how I feel about that. She wasn't open to like learning. She was just
I was very.
Right.
I didn't have problems. Yeah.
So it's hard when like there's barriers between us that they immediately set and they don't open their minds up.
Mm-hmm.
And I think that's like one thing like the youth they know about these things, they know that it's bad, but that doesn't necessarily mean that they're gonna stop. And it doesn't mean that and that they have people around them who don't consider prevention as a thing. That's not part of their daily lifestyle or something that they recognize as a real thing.
Mm-hmm. Well, and I think what you just said leads to one of the gaps I see is this the connection between education and information and actual how people live their lives and the behavior and the things that they do. And that there's this idea, I think because there's been, we as a culture love knowledge, right? We think knowledge is power. Well, knowledge is a part of and is an important part of understanding our world and what we're doing, but it doesn't necessarily lead us to make changes in our behavior or do certain behaviors. Behavior change and behaviors in general are part of a whole ecosystem of things. And I think that part I heard very clearly from you, Megan, but also about how do we help people understand how people make decisions and then therefore what prevention is and why it needs to be bigger than just education.
Yeah, sometimes I almost feel like it's not just the fact that we're giving them resources, the fact that we need to open up their mind to these resources. You know what I mean? It's we have so many resources already, and yes, we need more. But it's also how do we let them know? Yeah, you can take these resources. This is a real thing. And there are some people who just you can't dig into.
Well, and what are the barriers there
Right.
for them? That are beyond. That's not knowledge isn't the barrier. There's other barriers. So what are those things?
Something I realized is people are less listening to prevention and doctors are more likely to listen to the mosque head, somebody within their community. So it's taking those resources and bringing it to people that they already trust and implementing it there. But then also it goes back to the funding aspect where we're implementing these resources in these communities, but then all of a sudden we're gone. It's where you guys took my information, you guys asked me questions, I told you what I needed, I told you how I need help. Then all of a sudden you guys can't help me anymore. So it's that trust factor, okay, I'm trusting this person to tell them what's wrong, what I need help with, but then they could leave that in you. And it obviously is not the provider's fault because they don't have funding, but it's figuring out how to make sure that we give people resources, we're able to keep up with that. Keep up with the community.
I feel like we're starting to get into what are the things we see. So maybe I think I just wanted to remember what. So I gave DOE. What else? I think we're in the place now where it'd be maybe great for us to talk, but maybe we should just take a break for a minute. It's been an hour and a half. We can eat some food and go to the bathroom. There's bathrooms down there. Does that sound okay to take a break? Yes. Okay. So maybe let's take a 10-minute break and we'll come back at 11:05. Yeah.
I'm just gonna mute the Zoom.
That sounds great. We are, okay, great, you're back on. Okay, so, great, I'm just sort of contemplating whether I should write stuff down on the sticky notes. I sort of feel like I'm going to, because the other folks that have presented, we can get their stuff, and I wanna make sure, I'm gonna write it down, because I wanna make sure that I capture it as you say it, so that you can correct it. Oh, yeah, should we admit, or we could just move seats.
Yeah, is that good idea?
Yeah, you just sit there and I'll sit here and I'll move my stuff out of here. No, I do have a lot of stuff, don't I?
Somebody's keys are
And this wind, like blowing
know,
on
the
me, is
tunnel.
really intense.
You guys can turn it down. There's a way too.
I mean, we tried.
Oh, you did try. Okay.
Yeah,
I didn't mean to
tried.
speak against the turning of it down.
Sorry,
You're fine.
Okay, sorry. So I'm gonna try to write stuff down, which means we have to do slightly slower, but we could just go around, and is somebody interested in starting and just sharing your thoughts? I have April's, I'll read April's to us later, I won't start with hers. But essentially this is our time to share what you all feel like are some gaps or things that are missing from your work or in the communities that you work with.
I'm not very patient for reason, especially when I mentioned prevention. When it comes to translations, but I think we always are talking about physical translations, but we never think the verbal and the video translations, because a lot of people speak their native language, but they do not read it. So sometimes they don't have the capacity to understand what you guys are getting at. And then I think also the two-generational approach to something that's lacking, especially within immigrant and Black communities, where you're working with families, but you're not really working with the family structure, because parents don't even understand what substance use disorder is. But then you have youth who are learning it, but then also have the capability of to get their hands on certain substances, but then families don't even understand what that is or where they're getting it. So a mom could find substances in the child's room and not even know what that is. But then also in the realm of getting them healthy resources, a lot of these resources are not functional. A lot of these hospitals and rehabilitation centers are one size fits all. One for all.
Yeah.
Sorry.
That was great.
Can I plus 1,000 the two-gen approach?
Yeah.
Two-gen, whole family.
Really stoked.
Yeah, I just feel like it's a real thing that I've seen that we really, as we're talking about interventions in particular, that they're targeted at a young person and not within the context. Really leaning into this family context, the community context, that is so important for us to think about. It may be a slash or a different item. I would say even beyond cultural competency, cultural brokerage. When you were talking about it might be the person at the mosque who's actually the one how do we really lean into folks who already have the relationships, are in and out of the community, and can help have those conversations and support those things.
Can I add also for the family branch to make sure that we're giving resources to children who are affected because of their parents' addiction? I feel like that's really important. That's also a good way to spread awareness and advocate for the mental health side of it. And also how heavy it really is, not just the one person addicted, but also everyone who's affected by it. And that's a really good way to start.
Right. I would echo the cultural piece right now. Yesterday and today, I'm doing focus groups with multilingual families and interpreters, and and did ones with students. And just disconnect between yesterday I was talking to a mom who, because families are working 2 jobs and all this, and they don't have time, and just to hear that reality, and another dad who has 3 children, and we brought them to it, even though we're trying to do separately. We actually called his family to come, and he's working at Hanford, making $16 an hour. He has 3 children. You know, you just thought the time to be a parent and get into it, it's not available. They're just so low, so I would definitely put these
Yeah, me too. I guess I like this approach. We're sort of like saying one thing and then talking about. I think I had culturally relevant prevention approaches in these for different groups of folks that we don't have enough of that at all. And I also have a whole family 2-generational programming as like a star. But like the 2-generational approach, I would just echo that like times 1,000. Anybody else have things to add to these things that we have up so far? I know we'll get to other things.
kind of connected is showing the research that by having a Black student union or GSA in a school, even if those groups never meet, even just having a sign that there is this club actually reduces risk. And I know Liz, my club board, taught me that. And to find out that advisors to these groups do not get a stipend, and some groups, like in the National Honor Society advisor, they get a stipend. So you're just learning that and going, but so showing the research of the importance of the human piece to deal with prevention in schools and communities would be helpful. So not just because again, so many people don't understand prevention in our communities. So when you can lay it out, these groups are at higher risk. If they had the opportunity to connect, get support, you know, it's gonna show just so not just going to do that.
Yeah. Well, and they're at higher risk not because of anything they've done, but because of the environment in which they live or the way people treat them and discriminate. How much discrimination, how impactful discrimination is on people's risk for substance use is pretty remarkable. I would say, I'll just echo that for April. April said there's an urgent need to focus on high-risk populations such as LGBTQ+ youth who face higher rates of substance use. Despite this increased use, there are very few primary prevention strategies specifically tailored for LGBTQ+ youth. Aside from the 2022 LGBTQ+ youth tobacco needs assessment, there's been a lack of comprehensive needs assessment targeting this vulnerable population. Addressing these gaps requires a concerted effort to develop and implement tailored prevention strategies and to provide adequate support and training for youth to actively participate in and lead these efforts.
I agree, especially when it comes to like evidence-based programs and data, there's not a lot of data with communities that are just now being like, I'm struggling with this. Like I've heard so many times that somebody was like passed away in their street, even though that they passed away from an overdose. So like how are you supposed to get data when they're not attending to like what happened in their communities? So I think more data is needed within like communities that are not talking about it and haven't been talking about it, because I think it's also a way for people to be like, okay, we are struggling with this and we need help because we're I think like in a sense that's why I was doing so much that I was doing, because unfortunately there was so many losses at that time. And if I had started like a year earlier or a year before, I would not have been able to have those conversations because people were not seeing it.
How about other gaps you all came prepared to chat about?
One of mine, and I think you brought up this, is like incentives, and that's hard, for people that might come up to us when we're taking or something like that. There's no money in those so that for us to buy incentives and be like, oh, you want a T-shirt, you want to see what we do, because when you have that conversation, it's great. But when they go home, they forget about you. And if they have a keychain or a T-shirt or something, then they can keep thinking about what you do, and that puts you in their minds.
And I would say incentives is maybe a broader thing that I was thinking about when Megan was talking about lack of stipends and for focus groups, and I'm thinking about advisors for groups that we really want to see.
Right.
So like, how are we compensating people for their time to participate in this really important work?
So going back to like the father who is like working day to day, like he can't come to this group, and like him leading that is like being a part of the vision and using his time. So being able to give him stipend, he being able to be like, okay, I'm being able to be a part of this space and talk about it and get myself resources, but also I'm not losing out on.
I am gonna write food.
Yeah.
It's like such a teeny amount that we would need for money for food, but having some money for food would be such a work. People come together around food, and our work is relationship building, and to do relationship building without food is like kind of hard.
I'm so glad you said that, Liz, because whenever you ask people about that, somebody will usually mention food, so I'm glad that you mentioned it.
So, but it's all under this. I love it under this is like a kind of category.
Yeah.
I think, sorry, for prevention within like the school system, having like resources within the school, because sometimes somebody will see their friends struggling or somebody will be struggling within like the school system, but then they have to leave the school in order to get resources, and then once they go back behind. So having resources within the school system to help like these struggling, also like not the motto of like don't use substances or your backers, but like having them understand that like okay, why, like the understanding of why something is used, or why like what substance use disorder is, or the fact that even like substance use disorder sometimes is hereditary. So like that one time that you use, you could
I would say those resources during the summer months, just learning that that's actually really not good time for students. And who can't access resources. And we did with a freshman female student who said she's been depressed and cutting herself. And we're doing a tobacco prevention focus group, right? And she was saying her parents are like, they don't believe in depression. And he said, that's a white thing. You're being dramatic. And we're like, really? Because we do have school-based health center, but you have more social workers. And she said, yes. And then you go, oh gosh, what about this summer? And your parents, they'll believe, now you're feeling. And so we do have a social worker that's 8 to 12 all summer long, which is great, but how to get to school, that's a foundation. So it's a cycle of, great, but if you can't access it,
Also having like social workers and like people like counselors who are people of color or from these communities, because like a parent is more likely to listen to somebody like that, like okay, maybe it's not like so whitish. This person that looks at this talk about it, and they're telling me that it's real.
I lost the thread there and didn't write it down. Because I was just thinking about also one of the things we've heard from folks a lot is that it's not just the need for behavioral health resources. It could be that it's affinity groups. It could be that it's skill building groups. It could be that it's these other things. It doesn't always have to be a behavioral health worker. But we need that flexibility of addressing what the need is that young people are saying is the thing. And so is it a group of folks who would love to have a mentor who is from the community they're from? And that's not a behavioral health group. But it is substance use prevention in that it's a tier 2 sort of affinity group. But I think that having resources within the school, I think one of the things we have been identifying is this need for the infrastructure for that, much like the community school, like you were talking about. I mean, in community schools, you have a community school director who's not thinking about the academics, they're thinking about how do they get resources, community resources in the school, and that their job then is to do that. So then the principal, who doesn't have time to do that, isn't doing that. They're doing their work on academics, but this community school, but it's an infrastructure for bringing in those resources, and I think we really need that infrastructure.
I think it's also important to add that it can't just be in like the nurse's office or like, in the main office. It needs to be everywhere accessible, because in the nurse's office, someone who has addiction or is using substances most likely won't go to seek out that help unless, like, mostly they won't go to the nurse's office. So it's like in a classroom where they can see it or stuff like that. It's usually more helpful. Yeah.
I was just gonna name that, so I think that I was gonna pivot to stigma, but I wanted to plus one around another thing with the community schools is it's not just bringing resources into the school, but it's attempting to build relationships between the school and the family, right? So some of the most wonderful examples of that I've seen are like a homework night where you come and a homework diner, right? Families can come in and have a meal together, and there are teachers around to be like, yeah, I don't remember how to do that fourth grade math because you guys do it differently. And that's speaking from personal experience. Can we help you with that, right? So it creates, I think, also relationship with family, and I think can create more positive connections with the school. I was going to name stigma next. That feels like something really important to name. As part of the child safety and gender well-being plan work, we did lots of community engagement across the state. Parents and caregivers, community providers, youth, all shared this as the greatest challenge to getting support, is that perceived community internal stigma around needing help, I'm putting that in air quotes, and also fear that people in the community will know that you're seeking help. And so I think if we want any sort of interventions that we're doing to be successful, we need to really take into account how we reduce the stigma around seeking help for a variety of things, not just substance use.
The normalization of these conversations, especially when it comes to stigma, but then like going back to the school sense, like having that safe space where it's like I know you space for it, like it's great to come, and then having that because like I've learned that like sometimes you have to put in like fun activities, fun events for them, where people are building community and growing amongst each other, and then like they have that aha like I need help, right, resources, and they're able to go to that one person that they feel comfortable with. So having that one in that space, but then it's very hard for the school sense because like people are like everybody's a teacher, like they have like a bunch of students, but like having that person whose job it is to like be that safe space for you.
I think when we talk about teachers, we also have to the teachers also need to understand. Like they need to know real data. They need to know like what you go through. They need to think because a lot of the teachers they don't understand. They don't like if you were to go seek like help from some of them, they'd be like, I don't really know what to do. I'll send you to the nurse. Like they need to be trained on like what's going on.
I heard Baxter, I keep telling little anecdotes, sorry, but we have an IEP meeting with a student. Usually you have to have like the parents there, the kid, and you have to have a regular old teacher during the meeting. And so this one history teacher, and we had a student was a senior struggling with anxiety, and this teacher said, "Have you tried using cannabis? It's really helped my daughter. She's up at Oregon. I'd be like." So there's a social worker, and I heard about it, I was like, did you? No, they didn't address it at all because it was just too awkward to go like, hey, Laura, what's actually, so yeah, when you talk about teachers learning this stuff, because they have such an impact, and they often are the ones students might go to and feel safe connecting with, but if they don't have really good info, that's not good. And coaches, so sometimes coaches, anybody in the school,
In the sense of like anxiety, ADHD, like depression, like the kids in the school who are struggling with that, but then like teachers don't know the signs of it. Okay, they just think, this student is slacking, they're not. So like having those resources to really understand that, having that conversation with them, but then also always making sure that you know that you're able to have that info, like what's going on at home, and you're having, so it goes back to student, because sometimes parents don't know what's going on until like their child's like not graduating with that letter. So having that tie-in where you're able to teach your students that.
And with ongoing training, I think that's also something big that we need to keep doing in schools. Like assemblies, they get the word out, but they need to continue those conversations throughout the school, and that's something that at least I know my school struggles with very much. Like there's not enough time, stuff like that, or like the rush to get through whatever their assembly is, and you know, they need to have those smaller conversations. They need to keep those conversations going, you know. And if school is the only way they can get that, then one presentation a year is not gonna do anything.
Yeah, and I'll say that leads to kind of my big gap, is that I think we're really missing more community-led strategies that improve community conditions and really build community resilience. Because I think we're counting on schools to solve this problem, and we're counting on education to solve a problem that will never be solved with education. And so it's like more funding for those community-led strategies, but they have to be community-led, and so that takes time for relationship building to be in that place. Like you said, around like you build up this relationship and then you lose funding, and then there's like a trust that gets broken every time that happens. So how do you have sustainable funding where you could do community-led strategies for improved community conditions?
You can put a Melissa Star next to that.
Okay.
That was and while you're talking about community strategies, I would say that intentional collaborative capacity is a really important part of that, right? We have so many folks that are doing issue-specific work and are funded to do issue-specific work, and they don't have the funding to do that collaboration. It was a really, again, resonant theme in the community conversations where folks were like, I don't know all the other resources in the community. I might be working with a young person or a family. I know what I have, but I don't have the time to work with other people to understand and to make those really cross-pollinating conversations, right? Oh, I have this. Oh, that'd be helpful to me doing this, right? So I think for a variety of community partners, again, I think we also over-rely on schools, and so who are the other community partners that need to be part of those really driving that work and funding it? And funding it is a huge gap.
I look again, Liz worked, she wrote my grant, so thank you for that, but I was gonna say, Liz was like, work with any adult that has an impact on you. So that's a zillion people. I would just add my thing is, like Megan said, 18 to 25-year-olds. For that group, and we have youth, which is the youth employees program that hasn't really taken off in South Portland. They're kind of helped get created, but so folks who aren't going to college, and then folks who do go to college, which is a higher risk environment than don't go to college. And I've met with 7 campuses in June and got their scoop on what they're seeing, and like mental health stuff is off the charts increase since COVID, and you know, just hearing from all of them, and then you'll hear from private colleges that really allow students to use substances Thursdays through Sundays, and they even have the cafeteria open at 2 in the morning for afterwards, and you're like, you know, you're like, what is going on? And just that there's such a lack of prevention on college campuses was very startling just to hear. What?
Yeah, I think like freshman year in college is a big time where they create bad habits. So if we can make them create good habits, I feel like they're more likely to continue through college with those good habits of not using substances. Because you're gonna have brand new people around you, you know, that's peer pressure is, you know, like it's like high school all over again. Peer pressure back into, you know, a bunch of different things. So.
And 1 in 4 freshmen drop out of freshman year. So that's a lot.
Feeling supported.
Going back to community partnerships, community partnerships with intention, because I think there's a lot of like, okay, we have to move through this, and we have to work with like different environmental community, community, and they're like, okay, we're gonna do this, tell us like how we can do it. But then like, we tell them how we can help, they help us, but then there's no like, follow through. All right, and then communities are like, okay, there's no follow through, so why are we gonna excuse ourselves? How do you guys just away? So like that intentional collaboration, but then also making sure that when those collaborations happen, that there's like tangible change that's happening. I know sometimes it's hard, but at least showing them that and trying to,
Relationship is a transaction.
I wanted to just highlight that I think we also just need like basic, more capacity for community identified prevention efforts. So I think when you were saying you work with my staff and we cover Cumberland County, I was thinking, I wrote it down. We have 7.5 FTE to do substance use and tobacco prevention. And we cover 300,000 people. You know, it's an hour tip to tail, one way to the other, which isn't huge, but it, you know, an hour and 15 minutes. It's 17 school districts, 20 high schools and 20 middle schools. So like just the quantity, and we now have, I think after a year and a half of NPN, I think we have like really some good work that's going where we really, our focus really was on, like we took an equity first approach. So our work was really on like, how do we support and work with folks who have the greatest barriers first? And so we've been doing that. But as we do that, other people are like, hey, wait, can you come help us with this? Can you come help us with that? And so now we're in the place where we have more and more school districts asking for us to support them, or more communities or more municipalities, and we just like don't have the capacity to do it. And we have the readiness and the willingness, and that just like crushes you when you're like, oh my God, people want it and we just don't have enough staff to get there.
Yeah.
It's brutal.
And it also speaks to that tension with the schools, right? I feel like we culturally want to put things in the schools and put sort of burden, if you will, the schools to do things. So how can we support them as a space where students and families are already coming to then support around these needs? And I think that means more capacity and relationship building to be able to provide that support rather than just saying the school needs to do this. Like, how, right?
And why do we not have enough prevention folks in the state? You know, that I know I used to help do interviews, and people would say, so it's $20 an hour, this kind of message from us, and is there any room for, and things are like, well, there's no climate, and they're like, I gotta live in Portland, I can't, you know, so just wondering about why aren't people in the field? Why don't they stay? They don't feel valued, and you know, we hear people saying, I'm not doing it for the paycheck. It feels good to do, you know, and after a while, so.
Somebody in a meeting I was in yesterday put it like opposite of that, where it feels like sometimes people who are in a higher position than you will weaponize your why to keep you. Like, you want to leave because you're not making enough money, you're not feeling valued or whatever, and the people who are above you say like, well, what's gonna happen if you leave, kind of a thing. So it's kind of like a rock in the hard spot, yeah.
I wrote workforce development, but I don't know if that's really exactly what you're saying. You were saying more like and pay. Yeah, enough decent pay.
I'd also like us to think about what the pathways are to the workforce. I know we're having a lot of good conversations around peer support and peer mentoring as sort of less clinically, less education heavy opportunities to participate in the workforce that I think in Maine in particular we really need to be thinking about as we have for workforce challenge across the board, right? So.
I think, at least at my age, like a lot of us, like, you know, it's hard to find a job that wants us or like that we want. But I think if you put internships in there, you know, it looks good. Like when you go to college, it looks good when you get into other jobs, and like, you know, they're more likely to like go and do it because usually you can do like maybe you can squeeze like 10 hours a week, and you know they can just help you do other things that maybe you wouldn't have time for, and that means, you know, you can have 1 or 2 interns. And you can rotate through people, and that gets them interested in prevention and, you know, stuff like that.
And speaking of term,
oh yeah, yes, paid internships.
Paid for all the things. I just want to make sure.
Or stipend. You can also do stipends. Those are a little like.
I believe April. I just want to make sure I get April's pieces in here. She also talked about. I'm just going to read it because it's not clear enough. Increasing youth engagement and participation in primary prevention efforts in Maine is crucial, especially in addressing substance use prevention related to alcohol, cannabis, and opioids.
Youth are uniquely positioned to influence their peers and communities, making their involvement in prevention strategies vital. However, federal funding restrictions pose significant challenges to effective youth engagement. For instance, current federal fundings do not allow for stipends or provision of food, which are essential incentives for encouraging consistent youth participation in prevention efforts. These restrictions hinder the ability to fully involve youth in meaningful ways, thereby limiting the potential impact of their prevention efforts. I mean, we have that here, but I just want to leave a lot of it in here, but I think more youth engagement.
Yeah. And I think we've spoken to it a little bit in terms of the incentives, but I wonder too if there's maybe not a gap, but it's a challenge. Like flexibility of funding has come up in like lots of different ways, right? And so how sort of restricted funding and what I think about flexible funds for families to meet basic needs. I also think about flexibility of funding around engagement. So just how that constricts the work that we're able to do.
Along those lines, Liz, is there like a mandate that all of the money that you're talking like 3 million for, whatever? Is there a mandate it all goes out immediately, or is there like a world in which there's a fund developed that could be used over time?
Yes, let me answer that. But I forgot what you just said here. I don't want to lose it. Flexibility funds for meeting families' needs, but also for.
I think it goes up to youth engagement.
Oh, yeah, that's what you were saying. Okay, I'm sorry, Sarah. I just didn't want to interrupt. No, you didn't. And I just. So the initial money that was so there was like that initial provision that was just like, how do we get out some funds right away? And because we had 15 million in the bank, so we could allocate money that was in the bank. I think it's more that like the money comes in these in different amounts each year. So the finance committee of the Maine Recovery Council like tried to figure out, okay, so how do we take in money? Then we came up with a whole different versions of how to do it, because you could take in money each year and say, we're going to allocate 10 million every year. And we actually could have done that because there's sometimes the settlement funds came in larger bulk sums in the beginning. So we could have said, let's just do 10 million every year. But instead, I think our group felt like we should do some upfront, like really front loading, since the money came front loaded and the needs are so great. Let's do some front loading of some funds. And then we can only do that for so long before we just don't have any in the bank, so we have to wait. And there's also the issue of that we're on 2-year cycles of how we were nominated to be on the council. And so I think we all feel like we don't want to say how long somebody can spend. Like we don't want to make a decision that then impacts the group at 2 years from now. So I think what you're suggesting of like, could you put in a fund and then have that fund go over time? We might decide we wanted to suggest something like that. I don't know. The council would have to sort of like figure out if that's even possible, because it would hold, a group to that beyond the 2-year cycle that we're in.
Yeah.
So for those of you who haven't been watching every meeting, which I surely hope you haven't, it is a web of those kinds of things where you think oh, let's do this, and then it's like, oh, but we can't do that. It's just like so many things that you don't even think about until you try to unravel it, and you're like, oh my God, we have to make that decision and that one. It's like so many tiny details. Mm-hmm. And I think that's why it's taken a little while to get the first round of funding out. Not that we all felt the urgency, but it's the complicatedness of how to do that with an organization that is essentially brand new. So that was a long-winded way of answering your question. Mm-hmm. So there are some ways that we could do something, I think, where there's but we can't make a commitment for a group.
Yeah.
But it doesn't prevent folks from coming back every 2 years and asking for similar funding to what they received.
Wouldn't prevent them from that. And I think that's part of what it is that I think the way we were seeing it is there are some things that would be one-time funded and some things that once you fund it, you're kind of on the hook. We need to know that you're on the hook for it. But we're on the hook for it for only 18 years. So, which is actually a long time, but it's that we don't, by the 18th year, I think, if I remember correctly, I don't totally remember, but I think it's like we'd be down to only being able to give out like less than 4 million.
Yeah, a few million. We only get like $1 million in the 18th year from those.
How much?
Like $1 million in the 18th year from
Okay.
distributors. So a lot less than the 20 million we received the first year.
So it just goes down and down and down and down and down and down. So I think that's one of the reasons why I was asking Megan about, like, are there things that could have an infusion that would then generate more sustainability, because it's not like the general fund, which, where there's, even that fluctuates all the time. But I'm just saying, it's not like we could allocate and then have it be allocated every year.
But I would say it is similar in the sense that it's on a 2-year cycle.
Yeah.
The people change every 2 years.
Totally.
So also where there is an opportunity with the settlement fund to get something going and then consider sustainability from another source, right?
Totally.
So
For sure.
And so your time is only 2 years. Can you reapply?
You can be on it for 4 total.
Yeah.
And they don't have to be consecutive, but you can only be on it for 4. Yeah, and so the next round will come up this November. So we'll want this wrapped up before that, so that what we might be suggesting ends up going to the kind of next council I think this council will use some of it to do some things right away, but based on like how long an RFP process takes, or if we, or if there's things that it's like sole sourced or whatever, that stuff maybe could get determined before this council ends. But I feel like whatever we produce for them is whatever we will have is a great source for the next council to go in with a better, like a deeper understanding of prevention and what the needs are.
thank you. Liz, I had one more
Please.
thing to add.
Yes,
I mean, I have so many more things, but I tried to be somewhat concise about it. I think we had a specific focal point on like community conditions, and I would also say a specific focus on the economic conditions at the family level. So again, as we talk about whole family approaches, just comes up again and again in conversations with families that they are experiencing economic hardship. And I think also this conversation of they're not quite, the hardship isn't significant enough for them to meet program eligibility for certain things, but it's significant enough for them to feel like they're really pinched. And so, there's federal poverty level data. There's also some really good ALICE data that gets at that level of like, what does it actually mean to be able to meet your household budget? So,
Do you mind just sharing what ALICE is?
yeah, I knew when you asked me that if I was going to be able to think of what the acronym stands for.
We just said it yesterday.
I know.
It's asset limited, income constrained, employed.
Oh God, that was amazing.
Thank you. It's only because we said it yesterday, and I was like, I'll never remember income constrained.
Yeah.
But then because I said that, I So it's essentially people who are employed, but still can't meet. They don't have a lot of assets, and they can't meet their economic needs, their basic needs.
Working for.
Yeah, I think it's a different way.
And I think it's this way of understanding, as we've been talking about, social determinants of health and the relationship to, STD prevention. Similarly, like this layers of stress that can build up on families, right? So if you have substance use issues and you're really struggling to meet your basic needs and, right? And that can really lead to some breakdown in a lot of things that we're concerned about for kids and their parents.
Can I add to that and say that I don't think it's come up, but it's a thing I have heard is then the grandparents and next of kin.
Yes.
And kinship care and folks taking care of children who were lost their parents or guardians to substance use disorder, and that those guardians are really struggling.
Yeah.
And many of them are on fixed incomes.
Right.
Because they're actually older adults and they're,
And I would say even more broadly, not necessarily because they've lost the parents, but because the children have been removed from the parents. So I will keep saying this data point to folks. I know we're talking about prevention. 55% of the children who are removed from their families because of safety concerns involved with parental substance use disorder is a massive problem in Maine, higher than the national average. has been for quite some time and continues to be. So I also think about that, like, whole family approach and that cycle, like interrupting those generational cycles. How are we supporting parents who have a substance use issue when they're pregnant, when they're new parents? And then as we think about, I think Madeline brought up the point about young people who are living with a parent who has a substance use disorder, that just really, I think, needs to be a part of that two-gen approach to prevention.
Kind of change the topic here. I think she had talked about how like there's a gap in funding for alcohol under the age of 18, like alcohol prevention under the age of 18, something like that. But I think that's like big, like in high schools, like there's so much talked about vaping and smoking and stuff like that. But I feel like the amount of like alcohol prevention, it needs to be more. So more talk about what effects of alcohol, what they can do.
At all.
It's like trying to find a happy medium.
I would say too, I think to build up that like supported conversations, we did a couple of, when we did the child safety and family well-being plan, young people's experiences was something that we recognized wasn't reflected enough in the first version of the plan, and also the BIPOC community. So we went back in specific focus groups, and I want to reflect back some of the things that young people said to us. One of them was that desire for more support for their parents to talk to them about some of these challenges, that who can help parents and young people have some of these difficult conversations, was something that they made, like wanting to talk to their parents but being worried about how that conversation would go. And I think also something I really want to lift up here, young people saying there's so much focus on crisis and not on wellness. Mm-hmm. And so I think as we're talking about prevention, I'm also like, how are we promoting, right? How are we promoting what we do want to see and not just talking about what we don't want to see? Mm-hmm. So that was something that came up a lot specific to the conversation about mental health, but the folks are like, young people are saying, we're only hearing about this in the context of the crisis, and how are we being supported to think about our well-being?
There was talking about like starting conversations, and there was I don't know what her name was, but from someone from the CDC had us look over some cards that she made. I think it was about alcohol, and we looked over them and we talked about like it was like starting conversations about alcohol, and I think they would be helpful in a conversation with like parents and stuff like that. Like if you're if they're at a restaurant or at like a library or whatever, you can pick them up and be like, oh, like it was like how do you see people around you affected by alcohol or something. And just being able to talk about the substances, and then maybe it's a more open conversation when you have to talk to them about, like I did this, like I used this.
Honestly, the thing for me with parents too is that it's like the support for how to have this nuance to what we call authoritative parenting, which is providing accountability, but with love and support. And I think we have, our messages aren't always nuanced, and there are some parents who are using authoritarian tactics. They're very harsh, very hard consequences, and then there are parents who are incredibly permissive, and that neither very permissive. And so those require totally different skills and messaging for those two different groups of parents. Because if we just say, make sure you're telling your kid not to use drugs, like that might be done in the context of authoritarianism, which actually can be like turned into like some sort of abuse or like and then we shut down the conversation. But also in that permissiveness, like don't do anything, but then when I catch you doing it, I'm like, oh well, nothing I can do. I hear a lot of like, well, there's nothing I don't know what to do about it. So it's not as, I feel like it's not as simple as just like dialogue. It's this like, how do we have the skills for doing, it's like skill building, and I haven't come up with the magic sauce for how to do that skill building.
I'm so glad you said that though, because that was, I think one of the young people said that, like that my parents would have the skills to have the conversation with me. So I think that's, I don't have the answer either, but it is a skill.
And I mean, I think like Triple P is one of those things. It's a great skill to have, and like there was PERK at Opportunity Lines, which was amazing. Like if everybody could do PERK, I would totally, Deb Dunlap, like I'm calling your name. Like but getting folks to go and have the time when you're a working parent or when you're, or just whatever you are as a parent. And so I don't know what else there is here for that skill building work.
Also community. Because for us, we've been doing a lot of like mom groups for parents. So like we have moms who come in to learn from each other. So they're able to talk about their experiences, and then there's time for all to step back and then they'll like explain to each other like what they're doing wrong or like what they, like their mindset of like why they see it this way. And then we also have it where we have like youth come in. They're not their kids, but they're other youth who are able to ask them questions.
It's like a proxy.
They want to ask.
Okay, that's so cool. That's awesome.
So like having like community groups where community is able to connect with community. Because sometimes it's easier to hear from somebody from like your community who has been through like experience. Because like it goes back to like, the stigma where sometimes people are uncomfortable talking about it with like outsiders or something. But when they see, okay, you've gone through what I've gone through, or you like lost somebody, or your child's going through it, they're more likely to talk about it amongst each other. So we kind of have very like nice conversations where people are like, oh, okay, it's not just me.
Yeah, that's awesome.
We need we need you know, because you know when you're a new parent, you're taught how to like parent a baby. You know, maybe they need to continue those classes. So like, oh, you're just like how to parent a teen.
By the way, you're not, and it's a problem. That's a whole other conversation. But like, there's no guidebook and there's no like necessary training for everybody. But yeah, I love that idea of sort of how do you. Yeah, and I think parents say this, like there's an assumption at that period of time when you're a new parent where you maybe need more help, but then you've never been a parent to a teenager, which is a totally different beast, right? So like what does it look like to have sort of, to feel like it's normal to experience different challenges in parenting along the way, and that like that's an ongoing learning process and supportive.
Okay, are there things people had on their list that they want to make sure goes on the board that we haven't put up here? I'll let you.
I'm gonna build off the idea of peer groups. I think social connection is something we don't talk enough about in prevention as a protective factor, and I think more opportunities for young people to connect with other young people in safe and supportive environments that are not school. And I think the same thing for parents and caregivers and families, right? That we are creating more support for each other in all of this.
We've been caught that. I mean, that's like third spaces. Yeah, for young people, right? And then for parents and caregivers.
I think one thing that really helped out is the need for resources, especially when it comes to like mental health and substance use disorder. I think more resources geared towards young men of color, but also like who are struggling with this, because I think like especially with the society that we live in, men are more to like not talk about what they're going through or like ask for help.
Be a man stigma.
Yeah, I mean, I'd almost put that under. Well, I was thinking we could get to sort of theming, but I sort of feel like this one could go under that theme of culturally relevant resources, because in some ways we don't. It's just a different version, right, of that, but definitely a need. Other things that people want on here?
As anticipated, it's not a short list.
Yeah,
but I think there's cross-cutting.
I think there are. So that was what I was thinking. So we have 30 minutes left. And so if those of you who are okay to stay for 12:30, I'm thinking maybe we take a second to look at these. I'm in the way. So. And I'm thinking it'd be nice to do some theming now, so that when we get to talking next time about different possible, like which prioritizing that, I really want to do it by themes. And I just have a quick question.
Is Madeline, are you watching as Madeline? Like, I'm aware
Madeline disconnected from the Zoom for a while.
Oh, okay. Having been the person who's been doing what everybody else is in the room.
I was going to ask though if I could take a picture of this or something so that we could post it on the AG's website.
We could either do that, or I think we were both taking notes.
Oh, okay, so if you're
I might have missed a word.
That's perfect then. Then I'll just post the minutes.
I think that'd be better.
Meeting notes, yeah.
Because, like, I also know I'm actually kind of a bad speller, so I think there might be some problems.
Looks good to me.
Are you required to have all of the notes daily, or?
Yeah, I do need to post the notes. Sorry, I forgot to plug in my presentation laptop, but Madeline's also not there anymore, so I guess it's not important that you can see the people on Zoom. They can still see you. That's all that matters.
So, yeah, and I took notes of the other section too, so we can like do a little comparing, and then we can take these too. And
It's like communities.
Yeah, I feel like a big community is like.
yeah, like what can we do some qualifying of community though? Or just like need for more community intervention, like interventions in the community.
Intentional collaboration, community prevention.
Okay, so community, what if I just do this, community? And then all the ones you think, I'm gonna circle them in orange. Okay, how does that sound?
Yeah. That's next one down to.
I would ask where school fits in. Is that part of community or separate thing? Okay, okay.
Social question?
Yeah.
Yeah.
Which one?
What about
This one? Oh, this one, yeah.
That is also a big point.
Yeah, maybe that was like a separate one. How do you feel? Are you okay with that, Emma?
I think probably themes is going to be a bigger process.
No doubt, yeah. Because I want to add in the ones we got, the other ones too, and so then we'll have to like, I think they'll fit in.
But the ones you.
We can double color that.
Yep. Having resources in the summer.
There might be some like school.
Right.
projects.
So-
It's like red diagrams.
Yeah. I do think each can fit in both, like.
Yeah.
Yeah, okay, so I feel like that, is there any more data ones?
I think we didn't talk a little about data, but I think what they said in that thing.
Yeah. I think there's.
And then we have this one, yeah.
I think
There's enough meat there.
Yeah. Same thing with funding.
Right.
If we didn't touch on it here, it's definitely captured.
Yeah. Okay, another theme? Yeah.
Mm-hmm.
How about like family system? So we were talking about grandparents.
As a theme?
Yeah.
Okay.
Family, community, because it could get within, but it's close.
Yeah, I think if you wanted to change.
Yeah.
Second one down on the first page, or second one from the bottom, community conditions at the family level. You read the one above that too, the flexibility of funds.
Yeah. Yeah.
And another orange one is that workforce development, like the orange, like. That's the down on the first page, and it's the fourth one down, it's right.
That one?
Yeah. I don't know when that goes exactly.
I feel like that's like its
Own
own
thing,
thing.
yeah.
Like I wouldn't want to see it lost.
Yes, yeah, maybe it's its own.
Maybe it's like money or something. I don't know.
Do we feel like the stigma one, does it deserve its own theme, or is it?
I could see it going in cultural competence, but I feel like it's such an issue that I maybe want to keep it separate, at least to start.
Colors, but it's okay.
And another one might be capacity. That's what we're talking about. Forced help. Maybe that's what it's called.
And school something.
The only thing I'm wondering about capacity, so it sort of feels like that's like,
Yeah.
it's everywhere.
Who's gonna do it? Yeah.
Yeah, and how, right, yeah.
So it's not like the what, it's the how.
But maybe it's the capacity is like an infrastructure problem as opposed to, because these require capacity too, but I think this other thing that's like the workforce development, the intentional collaboration, the needing more resources, I don't know, I think I said it, for just like doing the work,
Right.
is all like infrastructure. I feel like Megan said it in a different way. Well, I'll look and see what it, I don't know if you remember Megan. Where's that? Oh, yeah. Oh, I'm sorry, it was probably not, I know, I just threw your name out. You identified the like infrastructure capacity issue. I do remember how you said it, but I can look at your words, because I wrote them down. Sorry, that was.
I like the idea of infrastructure, because I think then you could get at like, what does collaboration look like? What does, yeah. I think that's what we're talking about. It's like
human.
Yeah.
Capacity. Because then that one is like, it's this collaboration.
Building relationships. Yeah.
It's the,
Doing the work.
like, where else was that one?
Yeah. Incentives, where's that incentives?
Oh, yeah, the incentives
That's
one.
more funding.
Yeah, but that's, it's not human infrastructure, but it's.
The advisors part of this, you know.
Oh, yeah. This.
That's cool.
That's so gross.
I know.
Yeah. I think in schools, right?
Okay.
And there definitely could be some cross-cutting items, right?
Yes, of
Like,
course.
Let's
Yeah.
bucket it and
Yeah.
say like.
I have a black marker, it didn't work very well, but.
There's one here.
Oh, wait. Oh, you checked. Nice. Oh, a new scheme of colors. Okay. And then schools. Well, we're gonna have to like, name these a little better, but we don't have to do it right now. We could do.
They're buckets for now.
Yeah, this one.
Like youth engagement. Over here.
I was wondering the same thing.
A youth engagement bucket?
Yeah, because we want the community to do that too, right? So.
I feel like that does what the community.
Maybe you do get a weird font. So it doesn't confuse
And
you.
you also have 18 to 25 million like schools to talk about college and.
That's something.
This one. Oh, this one was, I meant this, that's like.
Oh, yeah.
I'm sorry, Alma, what did you say?
I think that could fall into community as well as school, but then it could be like,
Should we use this in zone section? Yeah, this is the question, is youth engagement zone, or is it within? Because it could be family engagement too, right? So like, yeah. This could be two different topics, or they could be within those layers.
Okay, so let's do. That one, I think when we saying that school.
Yeah, I think that's
or-
more school. Because like there's things under it.
And that's the higher. That's a not. Right, like,
Right.
because some of the highest rates of substance use is among people who work in restaurants. In this age group.
Yeah. And what do we do with not engaged in work or school, right? So if we make it an education thing, then we have left that segment. Right.
It's just 2,500 young people who are that. What do they say?
Disconnected.
Disconnected.
Yeah.
Disconnected youth.
It seems like there's some
2,500.
things for like people 18 younger and 25 older. But in between, it's like, if you go to school, if you don't go to school,
If you go to school, there's at least a place where we feel like we can intervene with you, right, at the school. But if you're not in school, where are we going to try to reach out to you? It's more challenging.
For promoting instead of preventing crisis and well-being, I think an option for all is a community.
Yeah. It's sort of like.
So I think part of the purpose of theming is that then, like, these will go under it. It's not like we won't lose these, but it also then helps us say, like, okay, where are there, I'm trying to say this out loud for myself too, like, how do we get ourselves to a place where we're like, okay, there are so many needs, right? Like, it's like, so we're gonna have to do some sort of rubric where it's like, what key themes are our priorities? Where do we feel like, I think keeping in mind this idea that it can be, we could be recommending things that might need long-term funding, but we also might want to think about some recommendations that are about that infusion that could lead to more capacity later. And some of this stuff can happen with more, just like more funding capacity. These will be things that maybe locally people will do. It doesn't necessarily require a recommendation from the council if there's like general money for something. But anyway, I'm just talking about it. None of this. Stop. We'll work it out.
Next meeting, whenever that guy, I don't know his name, but what they can spend, or like what the money can go do, is like helpful to think about when you want to give a suggestion.
Yeah.
How are we gonna think about that?
Yeah, and I can send you the MOU again, you can look at it. For prevention, it's fairly like, do youth prevention. And so our version of what we think that is, I think there's a lot of leeway in the prevention space, I'll say, in the MOU.
I mean, if you look at the two funding allocations from the last cycle, I think that's indicative of that, right?
Yeah.
So, which I think it's good, right? If we're saying it's family, it's community, then how do we reflect that in the recommendations?
Uh-huh.
For info on what people use and consenting.
Yeah. Yeah, maybe that's.
Or school. I wonder.
Or is it part of this? Some of this is in the.
I have a sort of like flexibility of funding. It might be embedded across themes, or it might be its own piece.
Like an eight, what's it?
So many Venn diagrams.
Yeah, like an 8-part Venn diagram or something.
I'm just trying to think what that is.
I do hope people watch this so they can see it's all going like this.
You said flexible funding as a theme? Yeah. I think so too. And some of that, like you said, will be under community. Some could be human infrastructure capacity.
Yeah.
Some is these incentives.
Right.
It is like a host of things.
Right.
You could do it in colors. So, I don't know.
Yeah,
Combo colors
yeah.
in your chart.
Yeah, I think I'll have to take this and like, and I can also double them, right? Like I just put them in both,
Yes.
so that you get to see them in both.
I actually think I prefer that, like if you think they're in multiple places, we'll just say them keep there and
Okay.
probably, fall
Yeah.
into it.
That sounds good. So I mean, they're double coded. And what I think I'll do is I'll do this and I'll send it to you all. And then perhaps there's ways we can get some feedback on any changes you want to see or things you want to, so that we all come next time. And I think Sarah and Aaron and I are going to meet and think about how do we like structure the next meeting so that it works best for all of us to figure out like how do we start prioritizing. And we're going to have to bring up to speed the folks who weren't here today because there are 3 emails here, but not here now. And so we got to get the other folks up to speed, and they might want to have some additions they have.
It does help that it's recorded, right? Like,
Yep.
And then,
Although
yeah.
this is a complicated,
They'll be notes.
a complicated version.
Can I get a moment of gratitude for like the folks that are helping us to show up here with our ideas and like maybe tested in some way, like,
Yeah, I feel like this matches what we see in what Lindsay presented. It matches. It's just like a little more, with more detail.
Yeah.
Matches what Megan's presented. It's more detail that I think is really helpful. So I think like taking their comments and their gaps and putting them all kind of in this thematic, then we'll start to figure out like, okay, how do we prioritize? And again, like, I don't know if you've been watching at all how you may not have, which is fine, the way the RFP that went out is going. The idea is that the Maine Recovery Council came up with priorities under the 3 pillars of their funding, and then asked folks to put in a letter of intent and tell us whether their idea for something that they want is one of our priorities. And if it's not one of our priorities, they can still put in for it, but they hit another button. It's like, it's not one of your priorities, but it's this other thing that we think is needed. I think we're having a little bit more, we're fleshing out like a lot more than the council. Like, I mean, if you read the priorities, some of them are very large, overarching, they cover a lot of stuff. So like, I would think a lot falls under those priorities. But our goal will be to come up with a couple of key priorities. And the council will still probably be able to give out things that are not in those priorities. You know, like they might choose to go to the other space too. But I think our goal is to give them some of these to say, these are the places that we all, like, this group really thought were important.
Do you want me to pull up the priorities from the other pillars or do you want me to write them?
I think that's okay. We can send them though.
That would be great, yeah. I know I'm getting a little bit ahead of ourselves, but I think it'll be important when we start to come up with recommendations to think about how we build understanding around how we got here. I think we all know in prevention, and I think understandably in the opioid use disorder space, there's a lot of attention on the crisis response. How do we make the case for prevention? And I think that's going to be important, how that gets articulated along with recommendations. Like, this is what guided our process to getting here. This is why we think it's really important. This is the money goes to this.
Well,
right. We mean prevention a lot of different ways when we talk about it. People mean it in different ways, yeah. So I think just very intentional about
yeah. And when you think of all this whole list here too, it's like there's one little line here that some people need some information on substance use. Like, you know, it's like the education part is such a small piece of this. You know, it's on here, but it's not the place where there's like the largest gap. It's not a knowledge gap. It's a I mean, there are times there's knowledge gap. I'm not saying there are parts that aren't knowledge, but it's knowledge plus skill plus environment plus, you know. And so I think naming that in the like how we got here.
Yeah.
But it will, I think what we have, which is nice, is we have all this, it'll go into themes, and so you can see all these different suggestions, even if they don't rise up to the top. It's like, these are the things that we all see, and that is in every report that comes out of the, you know, strategic planning process that the state does, that we all do. I mean, there's nothing not on here from every time I've done an assessment in the last 15 years about what's needed, you know? So it's just like, how do we bring it up? Which ones are priorities right now?
Did we ever get that number? The whole house?
Oh, yeah, did you find out?
Oh, yes, let me pull it up. It's, so I think it was like 7.2 million, but that's inclusive of one-time funding, so like ARPA funds and HRSA funds and the OPTF dollars. But I think consistent funding, it was like 4.8 million.
Okay, so
Annually.
4.8 million annually. Okay, is the,
And that's, you know, I think that's a big chunk of that is the PFS grant.
If there's 1.3 million people in Maine, that means $4.
per person.
I can't even get you a cup
And
of
not for
coffee.
general
I'm
funds.
sorry.
And not for general funds. Just gonna say that one more time.
So I just want to write that down. So we said, so it was about seven now, but 4.8.
So 7.2, so about a third of it is one-time funding, and 4.8 is kind of stuff was ongoing.
Okay.
That doesn't include our person, because the person's funds are gone. Yeah. And then ARPA, we're in our last year of ARPA, so. It's very good.
Okay. That's really helpful. So I mean, to think there's like, we could put a $4 million infusion in a year, it's like quite a bit.
Yeah.
So like, what, you know, what does that look like and where could that go? Like doubling and, you know, or bringing it back to what it is now for this one-time funding.
Yeah, and I think the lesson learned from all states from the ARPA and the HRSA is that it takes time to spend it. So I mean, you know, so it's what can be infused now, but it still takes time to
Right.
to spend it. So I mean, I think that,
Right.
you know, hopefully you guys have so much money now after COVID, but it takes years to ramp up and spend a lot of stuff.
And I think I really appreciate you saying that, Megan, because I think it's an important thing for us to think about as we're talking about things that are potentially new to Maine versus something that could it's already existing that could get some juice for this.
Mhm.
Yeah.
Mm-hmm.
That time piece of it.
I think also like, I don't know, stuff that we've done, like when we apply for grants and we get them, and they're usually smaller grants, but like money like makes you think. It's like, okay, you have money to do something, and now you can, like if you get more money, you can do other stuff. It gives you thoughts of like how you can use that money. So I think it's good that there's money.
Well, and interesting to think about that as a recommendation around the time period of like, you could get the 4 million this year, but given time to spend it.
Yeah.
Give it a longer time period to spend it.
Because often it's, you know, here's $1 million, you have a year to spend it, it's
Right.
so I mean, and it's really getting the hammering the point that correction, good correction.
And with restrictions like not being able to get incentive, it's really hard.
Which I think is what you were sort of suggesting is like, could you have a pool that then gets used over time, as opposed to like needing to spend it all at once? I mean, there isn't there's no requirement from the settlement funds that I can think of where if it's allocated, that it can't get spent over a longer period of time. I mean, we actually, the county, we're sitting on some funds just to figure out how, we have some stuff we've spent right away, and then we're sitting on other funds just to like figure out what to do with it better, and also to see it pool a little bit, and now be like, okay, now we've set aside $40,000 for
prevention. It's already 80 because we waited, well, because it's just, you know, we just had gotten it and we hadn't figured out what to do, and then all of a sudden it's 80.
What you do with that might be different now.
Yeah, and actually, how do we use it as like little seed money for something that's bigger, and then use that money for the things that we can't spend it on with a grant? So I mean, it's just being strategic about it, and I think providing a little bit of, because it's not like you're providing a service. So treatment, harm reduction, and recovery, in some ways there's like services about that. So it's like you offer a treatment service, or you buy a building, or you do a thing, and so it's money and then it gets spent. Prevention is different, and so we may want to include that in our recommendations. It's time how
I think when the space cards were a little while, we changed it that use space cards for every year.
Oh yeah, they're time limited.
Right now, you can have years.
I'm just making a lump out of that, because that feels like a separate item from this, like, recommendations. It's like a
Consideration.
It's part of this thing you're talking about of like, how do we frame how we got here? Yeah. Okay, here are our recommendations, and here's some other little nuggets of wisdom that we want to provide to you.
Chew these over while you chew over the rest of the recommendations.
Right. Okay.
I think they're important considerations, and you know, I'm really proud to be a member of this work group and to be doing this work with you all. And I've been looking at, you know, some frameworks for how people are thinking about using the settlement funds, and prevention has come up in several spaces as like not having a really robust source of funding, and so it being a really appropriate use of the settlement funds, as well as some of what Liz was saying, like if, you know, if it's a service and Maine Care can reimburse for it, you want to use settlement funds for that versus like buying a building, which, you know, you can get certain funding. So thinking about like where this is a unique source of funding, I think similarly around flexible funds that it could go out the door pretty quickly and be used by people. It could really be a need. So thinking about where it's, how we uniquely leverage the way that these funds are set up versus other funding streams.
Yeah. Okay, just writing these things down. Great. Well, it is 12:26.
And when's our next meeting, and it's virtual, the next one?
That's a great question. Sarah, what? The next one is virtual?
It is virtual.
Okay.
And it's going to be
22nd. No,
22nd, Monday from 11 to 1.
Yes, 22nd. And then the one in August is on August 20th, and that one is in person.
I will need you too as well.
Okay. Okay, yeah, that's what I have too.
Right, so the next two are like, focus on the recommendations, right?
Yeah, focus on the like prioritizing, thinking through, yeah, I think that's our. I'm gonna get some help from the BTTC to help us figure out, like, just like, how do we want to frame, how to lead those so that we, I feel like we all have a good sense, but it's like, how do we have some processes for prioritization? So, yeah, because it feels like it could be hard to get us, there's just so much to do, so how do we prioritize that?
Okay, the fun stuff.
Yeah.
Do you want to meet in the space the Recovery Council meets in next time, or would you rather use this room?
I think it seems like the other space would be good.
Yeah,
The
I mean,
space
it's a little bigger and
easier.
Yeah, way easier.
And the owl's a little further away.
Yeah, that's like causing some audio problems. It sounds like your voices are a little too close, so it gets muffled. But not too bad. But yeah, if we're in the other room, it'll be on the big table in between you guys. You can all spread out.
Okay.
It's only like 5 minutes away, so it's
great.
Drastically different location.
Great to see everyone.
Yeah. And I'm really glad we're doing this for the Recovery Council. I just also think I'm in lots of spaces where having this would be helpful for me and the other many ways that I do work to be able to say, like, lots of folks got together and talked about like what our priorities might be. And yeah, agree. Very, very useful in lots of times.
Yeah. Awesome. Thank you all so much for your time and energy and wisdom.